my name is Lane Foster, and I'm the Academic Affairs and Special Projects Coordinator for the College of Dentistry. Admission to the DMD program, so to become a dentist, is at least 3 years of university, usually in the College of Arts and Science in like a biomedical science program, because there are specific credit units that are required from chemistry, biology, microbiology. We do have a specific list of those classes that you can take at the University of Saskatchewan or the University of Regina. They're going to be switched to more general numbers of credit units to accommodate students who are applying from other places now, not just the U of S or the U of R. But so basically you have to have a set of specific classes, and those 3 years need to be 30 credit years. So they need to be full years in whatever program you're in, and including those required courses as part of those 30 credit years. Your average for admission to the DMD program is based on your 2 best years out of those 3 years. And you also have to write what is called the Dental Aptitude Test, the DAT. You'll hear that a lot. And there is a written portion of that, and there is also like a manual skills portion of that. So you actually have to make a little model to show that you have a certain level of manual dexterity as well to be admitted to the program. And then there is also what some of the other health sciences use, the multiple mini interviews. So that is also a part of the process still at this point. We did suspend it during COVID, but we're bringing it back for this upcoming admission cycle, which will be for 2022. And we're also piloting what's called the CASPER, which is a written portion, so that it is to help the admissions committee determine how well you can read and understand and interpret information that may or may not be related to dentistry at that point. And so for the certificate in dental assisting program that we have, it's a roughly 10-month program. Currently we have 1 intake, but we're about to move to 2 intakes, so that there will be 2 groups of 26 students completing this program per year now. And you can apply directly from high school for that program. You have to have an average of at least 65% overall and 65% in your either Foundations of Math or Pre-Calculus 30. In your English Language Arts A30, B30, or French Immersion can also be used in there. So I think that's just a 30 level. I don't think there's an A and B for that. And your Biology 30 and your Chemistry 30. So it is, we do look at the students with the highest grade. So it is competitive. So having the minimum average, of course, does not necessarily, guarantee admission. And then we also have a personal statement portion of that. So currently the question is, why would you choose this program, and what do you hope to do in the future in the profession? And then there's also going to be an interview portion this upcoming year to help the admissions committee determine suitability for the program, because it is a 10-month program. It is intense. There's a lot of lecturing that goes on, and an awful lot of what we call preclinical and clinical work that goes along with it as well. One of the last classes that a student takes in the Certificate in Dental Assisting is a 3-month practicum placement in a dental practice. It doesn't need to be in Saskatoon. We have students who are applying from their home communities outside of Saskatoon. And so some of them have been able to go back and do that practicum in their hometown. And then, of course, the practicum usually becomes a vehicle for a job as well. So we have many students who do the practicum and then often end up with a position at the dental practice that they've been doing the practicum in. So although it's technically not a co-op program, because the practicum is part of the whole licensure process for students to be able to complete the program, write the national examination, and then become a licensed dental assistant in the province of Saskatchewan. Or actually, they can take their certificate and go anywhere in Canada after they've written the exam to become a licensed dental assistant. And we are the only college of Dentistry that also has the dental assisting program. So students who are in the dental assisting program get to work right here on campus in our dental clinic on the University of Saskatchewan campus, and work alongside DMD students as well as general practicing dentists who are overseeing the DMD students. So they get a very, I don't want to say a higher level, but certainly a more inclusive experience as far as their dental assisting education goes, because they get to work on actual clients, not just in a kind of what we call a preclinical environment where they might be working on each other or on mannequins. Yeah, the DMD program is 4 years in length, so it's the 3 years before you are allowed into the program or admitted to the program, and then it's another 4 years after that. And the program, so for the first 2 years, students do a lot of anatomy and physiology, especially from the thorax area up, so the chest and up through the head. They do a lot of what you can call basic skill acquisition in the preclinical area. So again, that's orientation to a lot of the tools and diagnostic techniques and techniques for all of the basic dental processes and professions that are included in that. They start out by working on just wax models, and then you work up to like a head markup on a mannequin, and a little bit on each other. And then by the end of the second year, you actually are moving into the dental clinic here on campus. So you still are doing your lectures in a lecture environment, but you move from doing your lab portion in the what we call the preclinical area again. So we have a wet lab and a dry lab. You move right into the clinic and start working alongside year 4 DMD students, our general practice leaders who are dentists from the community, of course, and any of the specialists that are involved in any of the dental specializations, such as periodontics, orthodontics, those types of things. So you start getting exposure to all of the different facets of the dental profession. And but then again, so by year 4, you are actually doing full patient care from beginning to end, so diagnostics, radiographs, all the way through to completing certain types of treatment. Of course, I mean, we're not talking about putting on braces or full complicated extractions or those types of things. And then they also write a full national examination, and they can take their certification with them and go anywhere in Canada or the United States, so the full 50 United States plus Puerto Rico. So if you happen to be a Spanish speaker, you can graduate from the program here and go to Puerto Rico. The program is really intense. The number of classes does change from year to year. Year 1, there's fewer classes, but one of the classes is actually an 18 credit unit class, and that's the anatomy class, which is equivalent to 6 classes on from any other types of subjects. So they put a lot in there, and that includes your microbiology, your pathology, your anatomy. So it's quite intense, and they share that class with the first year medical students actually. And then they get introduction to basic operative dentistry, basic diagnostics, those types of things. And then year 2, of course, you're taking that a step further, and you're starting to integrate it a little more into the preclinical environment, where you're starting to work on the mannequins. A few of the sessions are on each other. And then year 3 is probably the hardest year in the program, because you're still doing a lot of knowledge and skill acquisition outside of the clinical environment, but then you start to transition into the clinical environment and applying all of that knowledge and skills that you've received to an actual patient in a chair. So there's a lot of extra hours involved, because of course when you're working in the clinic, that's time that you're not spending working or studying in your books. So often we have third year is likely the hardest. Fourth year, you're expected to have done really all of your solid knowledge acquisition, and you're moving all of that into an actual clinical environment in the clinic with a patient, and you would see a patient from beginning to end. So if they're coming in for fillings, for example, You do the full, radiograph, and basically what you would expect when you go for your own dental appointment to get a filling done. That is now what you are doing as a fourth-year dentistry student on an actual patient in the clinic. No, none of the courses that you take inside of either the Certificate in Dental Assisting or the DMD program are transferable to other programs. They're very specific to the profession and to our degree offering. As far as I know, we do not accept transfer students for other programs. You can't come in with advanced standing from another program into our program. We do have some vehicles in place for students who are internationally trained dentists, so they might have had a dental degree from a non-accredited dental school in another country, and we do have a program in place for them to be able to come in and do that. But if, for example, you decided to go to the University of Alberta and start your DMD degree there, you can't transfer to the University of Saskatchewan and complete your degree, and vice versa. You can't start here and move to another program. Right now, excellent. Even when you when you graduate from the DMD program and you pass your examinations, everything is open to you. So you can work for various agencies that provide dental care. You can go to work in private practice. You can go work in government. You can start your own practice, for example. So one of the classes that students do take now in the DMD is a practice management course in year 3 and year 4, so that they learn all that there is to know about setting up a practice, because of course it's not a cheap venture. We're talking millions of dollars up front to be able to start those types of things. So you have plenty of opportunities to either work for somebody else to start off with or yourself. Honestly, if you're a dentist that's unemployed, it's because you're choosing to be unemployed. Really, it's just one of those things. You can be a self-employed medical professional quite quickly as a dentist. A dental assistant, we do in this province, anyways, have a critical shortage of them, because there was only one program previously to do that, and of course. They're restricted in the number of students that can come in. We were able to set up that program here and started as well, because we already have the facilities in place to be able to do that. So we have now three classes that have graduated from the Certificate in Dental Assisting program. We don't have complete employment statistics yet. But the majority, anecdotally speaking, of course, the majority of the students who have completed the program have obtained employment at the practicum site. So I think what we could say for most of the students is that they have been able to identify their practicum site based on where they want to work, especially for the students from outside of Saskatoon, and they're going home to do the practicum with a job offer almost immediately after they're done. I think one of the things that we're finding out is that, of course, a lot of the things that make a great student in a lot of the other health science programs are the things that make a great student in dentistry. That desire to help people, to care about people's health, those types of situations, that whole, what we call, I just want to help people type of thing. That's the kind of attitude certainly that makes for a good student in the program. You also have to be, in either one of the programs actually, you have to be quite good at taking instruction and following it, to the T, basically. There's really no room for improvisation or anything like that, because a lot of the procedures that you're going to be doing in either one of the fields, the DMD or the dental assisting, are very specific. So you're not really going to be thinking while you're in the chair, well, what if we did this versus doing this? I mean, there are some of those times where perhaps during the diagnosis process you might be doing that, but other than that, you get into some very specific procedures. So you have to be able to follow, understand and follow direction. You have to have a pretty good mind for things like anatomy, because of course certain procedures require certain knowledge about certain parts of the jaw and the mouth and things like that, and what could go wrong if you weren't doing the procedure correctly. And then of course hand skills, having very good fine motor skills to be able to work in a confined area, because you're working in somebody's mouth and there's two of you often, so being able to work in a really confined space without of course causing any amount of pain, hopefully, for the patient in there. And so that fine motor skill for both programs is quite critical. And we're actually finding that a lot of students who are coming in are lacking those fine motor skills, because there's not a whole lot of work done anymore with cursive writing, for example. So, a lot of the writing skills that you would have developed, those fine point techniques in your fingertips and those types of things are not always there anymore. They have great thumb skills for texting on the phone, of course, but that's not translating over into a lot of those fine motor skills that are required in a dentist office in either one of those professions now. Well, for the DMD program, we are the only DMD program in the province. So if you want to become a dentist and you're from Saskatchewan, chances are you're going to look at us directly. But if you're from Saskatchewan, for example, and you're looking at becoming a dentist, and why you would choose our program over any other dental program in the country, first of all, we're at home, so you can save some of the money right up front that way. A lot of the professors and what we call the general practice leaders in the clinic and all of that, they're from Saskatchewan, and our college does a lot of outreach work in this province. So it's very, I don't want to say that the training is specific to Saskatchewan residents, but as part of your training to become a dentist, you are more in tune with a lot of what is going on in the province, and the program tries to make you, or tries to train you, I shouldn't say make you, tries to train you to be a very good dentist for the populations that you are likely to serve in this province. Previously, until only a few years ago, for example, the only program that you could take here was the DMD program. We are now embarking on what I would call a pretty serious period of expansion in the college. We now have what's called a Bachelor of Science in Dentistry program for current DMD students to allow them to start getting their feet wet in a research project related to dentistry and oral health, so that they can go on to master's and PhD programs in a lot of other areas if they choose. We do have a PhD program in place now, so we had our first intake for that just this past year, and we're looking at developing 2 new master's programs as well. So for somebody who's interested not just in becoming a dentist, but in a lot of the current and emerging research in dentistry, but specifically in oral health care, because a lot of the new research that's been going on, not just in Canada, but elsewhere, that oral health is an excellent indicator of other issues in the body as well. And so we're expanding our programs so that we can provide not just that education, but that training, and then the specialists to stay in the province and start working on a lot of those oral health care issues that we have in this province that are not so much unique, but certainly we have certain percentages of our population that do have their own unique challenges as far as oral health care is concerned. And our college is focusing in on some of those challenges so that we can provide a better kind of overall picture of health in the province, and perhaps get to some of those indicators that oral health can bring, proper oral health can bring to those populations, and in that way we can have a more healthy population overall. For the dental assisting program, I'm I'm never one to say that you should take one program over the other. A lot of it is still depending on what you want for a personal experience. But of course, the benefit of our dental assisting program here at the U of S is that you are working in you get to do your training in a fully functional dental clinic with full patients, and that you get to see some of the processes and procedures that go on in a full dental clinic well ahead of your practicum, and so that you can, even at that point, for example, as a dental assistant, you might be able to find one of the specializations inside of dentistry that you really enjoy, and that may facilitate the type of job that you're going to be looking for afterwards. So I did mention earlier, but we are the only dental school in Canada that has both the DMD and the dental assisting program working side by side. So the scope of experience that you're going to see coming to this program and being able to do the majority of your actual practical learning in a fully functional dental clinic is probably, I don't want to say priceless, but it's certainly unique in Canada and absolutely unique within the province of Saskatchewan. Yeah, absolutely. I mean, for either program, of course, you have to have all of the sciences. So physics is helpful for both. It's not really required for both, but biology and chemistry for sure. A basic grounding in your mathematics is required because, of course, you're going to be doing some calculations for certain types of procedures. CDA, the dental assisting students don't usually do some of those procedures, but you still have to be able to understand what they are and their effect on the human anatomy. So, for example, your basic freezing procedures and those types of things. CDAs are involved in that. They're going to be handing the tools to the DMD. So being able to understand that, that doesn't sound like the right amount of Novocaine, for example, or something like that. So you still have to have a good grasp of the sciences and the math to be able to do your job, quite efficiently. Of course, the English is we're an English language institution, so you have to have your Englishes. If you did the French immersion, that doesn't affect at this point. And then for electives, yeah, that's a very good question. I think I would probably say now for electives, if you could be doing, in our class, sculpting class, those kinds of things where you can develop some of those extra fine motor skills. You can certainly get some of those skills through a mechanics class, those types of things. So you don't just need to be focusing on the arts, but anything where you're going to be learning about systems and how they work and how they interact, and anything that's going to help you develop some of those fine motor skills to be able to understand, some of that linear thinking where if I use this and then I do this and I do that, those are certainly helpful now. And certainly we also look for some of those, soft skills, some of those interview skills, being good with people, because in either one of the professions, but certainly now in the dental assisting, they're the ones who do the initial interviews with both new and current patients. So you have to be able to have those skills necessary to develop a rapport with the client or patient, so that you are getting the information from them without making them feel incredibly uncomfortable. They need to know from you when you're sitting there in the chair, of course, that they're going to be safe and secure in your hands because they're in a vulnerable position. So that type of skill, those soft skills with people, are absolutely critical in both of these positions. A typical day in either program actually starts usually around 8 o'clock in the morning and doesn't have to end before 4 to 5 o'clock in the afternoon, depending on the time that you're spending in the clinic and the patient that you might be working on and the procedure that they're doing at that point. But a regular day, certainly for the first 2 years of the DMD program, usually is lectures and labs in the preclinical area. a lot of those labs are of course 3 hours long. Lectures are usually only about an hour, and then you go right from there into a lab where you're going to take whatever you're doing in the lecture and taking a look at it in a clinical or a laboratory setting. The DA program does often the same thing. The first part of their program is all very intense knowledge acquisition. They spend a lot of time in the class, and they start to transition into the pre-clinic area where they're starting to learn some of the hand skills and the tools and all of that involved in theirs. But they also start to spend some time in the clinic basically just observing what's going on so that they can see, from the non-patient perspective, what it looks like when you're actually in there overlooking, the patient in the chair and where everything is placed and what's going on. And then, of course, as you get to the final 2 years of the DMD program and the last, we'll say roughly 4.5-5 months of the CDA program, the lectures still remain about an hour each time, usually about 50 minutes to an hour, and you were spending more and more time in the clinic itself working with other students, together in teams so they could develop those interprofessional teams, the interview skills, everything that goes along with moving towards working as a professional, either as a dentist or a dental assistant. And the hours don't usually change. They're very often from around 8:30 to 5 o'clock during the day. And of course, like any other program, you're doing any of your extra learning outside of that. So textbook readings, we're doing more and more online learning. So less reading specifically from the textbook and looking more at those resources online through the university's online learning system, Canvas it's called. So a lot of the notes, the extra notes, those types of things go on in there. So yeah, after 8 or 9 hour day in classroom and clinic, for example, you're still looking at another 3 hours in the evening getting ready for what you're about to do the next day. So it's really intense. It is really intense. There's no doubt about it. So for the DMD program, we have up to 7 seats set aside for Indigenous students. Of course, there's all of the requirements to go along to prove the Indigenous. What we do first is that we take the Indigenous the candidates who have self-identified as Indigenous, and we put them into the regular application pool. So if they can be admitted through the regular application pool, and many of them are, that's the pool that they're admitted through. Otherwise, then they do go to those 7 Indigenous seats that are available. Of course, those are still fully qualified applicants. There's no adaptation or modifications made to the admissions requirements to get in. So we do have those 7. In the certificate in dental assisting, that's a little more tricky because currently we have 1 intake a year for 40 students. And we have 4 seats set aside for Indigenous students in that. But we are moving to 2 intakes of 26 students, and the decision has not yet been made on how many of those seats will be for Indigenous students. If I was going to guess, I would say we'd be looking at 3 in each one of those intakes for Indigenous students. I would say that, try and talk to anybody who works in your dental office. If you haven't been to the dentist in a long time, you may want to consider going to one, first of all. And then, ask them questions, see if you can observe a little bit more just to get an idea of what goes on in the office. Certainly be prepared to enjoy, doing biology and anatomy, those types of things, because, of course, that's going to form a huge part of what you're about to do when you head into either one of these programs. That forms the basis of everything that you're going to do. And then, of course, anything you can do to develop, your fine motor skills. So, of course, art, music, I think we left that out of the previous, things that you can do. Certainly band, if you're, used to playing any of the woodwinds or anything like that. Brass instruments where you're using your fingers to in multiple configurations to come out with the notes, that type of thing. Guitars, those types. Anything that you can do to make sure that you were either developing or maintaining your fine motor skills to go along with that, anatomy, biology, knowledge acquisition that you're going to use as a base for everything that you're going to do once you get in the program. And learn how to study, learn how to time manage. A lot of those time management skills are going to be crucial once you get into the program. One of the things that I can say, for example, about the time management is that once you're in the DMD program, either program, but the DMD program specifically, because it goes over 4 years, you don't have an option of just, retaking one class. If you don't do well in one class and you don't have the knowledge or the skills necessary in that area, you redo the whole next year. So you're not allowed to move on to the next year. So making sure that you have some good time management skills to be able to juggle multiple subjects and everything like that, to be sure that you can go from 1 year to the next. Yeah. Otherwise, you're doing either remediation over the summer to make sure that you can get caught up to everybody else, or you are retaking your whole next year over again. Yeah. I wouldn't say that I've had a career. I've had a journey. Certainly, I've had a journey, but a career journey, that's completely different. So my background, so I graduated originally with an undergraduate degree in history. I worked for a number of years as a teacher assistant or an educational assistant in the public school system, in the elementary schools. So I did that for a number of years. My wife and I moved to China and taught English for a year in China, in between all of that as well. And then I started working as an academic advisor at Medicine Hat College first, actually. So I did that for a couple of years. Then I worked for the federal government for a couple of years in the Employment Insurance Office. Oh, and then I went back to academic advising after that here at the University of Saskatchewan in the College of Arts and Science. So I did that for 8 years. And then I worked for 3 years in the College of Agriculture and Bioresources as the director for academic and student services there. Then I went into nursing, back to academic advising, because actually I do really enjoy academic advising and working with students. So I did that, and then I went into public health as the graduate programs coordinator. So still working with students, a little bit more of the administrative part there as well. And then, now I'm here as the academic affairs and special projects coordinator in dentistry, which includes a lot of working with the students and making sure that mostly on the policies and procedures side, of course, because for both of the programs, there's external accreditation requirements for the programs so that the graduates can meet and be licensed either as a dentist or a dental assistant. So making sure that our students are able to fulfill all of those requirements so that when they graduate, they can actually, work in those professions. Because of course, if anything is missing, for example, number of hours in a specific procedure, they're not allowed to write the exam, and so then they can't go and work in their chosen profession. So absenteeism is a big issue for that, because of course if you miss so many days and so many hours in a procedure, we need to find a way to remediate those so that you can move on and graduate and work in those areas. Certainly not what I started out with. And in between all of that, I did finish a master's degree in adult education as well. So I think I'm still on my journey. If anybody was asking me, I would say I am certainly not at my destination yet. I'm always learning. Starting a new program this fall in a certificate in university and college in administration. So working on that now as well. Done some business classes. I think the thing is that it's always a journey. You should really never stop learning, no matter what you're doing.